See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Hey, See You Now listeners, it's Shauna Butler with an invitation to dig in to all the Earth Day conversations, activities, and campaigns for individual and collective action. Earth Day, established on April 22nd, 1970, serves as a global reminder of how closely planetary and human health are connected, and is a call to action to care for and protect this precious and fragile planet that we live on. With a vast array of partnerships at the local, national, and global levels, Earth Day strives to broaden our understanding of the many facets of planetary and environmental health and highlight how environmental factors and climate change affect individual health, community health, and disproportionately impact vulnerable, under-resourced, and marginalized communities first and most severely. Earth Day includes a broad range of environmental campaigns designed to mobilize citizens around the world to improve air and water quality, adopt carbon-neutral lifestyles, increase voter registration, lobby for legislation to protect the environment, and gain greater environmental education. And nurses are central, pivotal players and leaders in protecting the planet and promoting sustainable practices in their own lives and workplaces. They collaborate across sectors to protect the environment and public health and lead research on environmental health issues. So with that, we invite you to listen to our episode, The Patient is Our Planet, recorded in May of 2021 as an ideal primer and prompt of how nurses are healing and keeping patient Earth healthy.
Sometimes people think, oh, we'll start seeing problems around 2100 or maybe 2050. We are seeing changes now. Our forests are being cleared. We're losing biodiversity. We're having an extinction rate that's 1,000 times normal of the species on this planet. The oceans are acidifying. Land is becoming desert. We have soil, air, water pollution. We have changes in rivers drying up, extreme weather events. Climate is part of the problem. It's a symptom of the problem, and it's much, much bigger than that. We're seeing increased impacts on cardiovascular diseases. People who are living with respiratory diseases are certainly feeling the impact of a changing climate. Infectious zoonotic diseases, antimicrobial resistance, heat strokes, malnutrition, civil unrest and trauma and strife, and mental health impacts of seeing a place that we love, a land that we could bank on supporting crops, become disrupted to the point where our livelihoods are gone and a place that we love has been destroyed.
Welcome to See You Now. I'm Shauna Butler. Man, that is a dire prognosis. The health of our planet is in serious trouble. The climate crisis is anticipated to result in increasingly warmer global temperatures, more frequent and extreme weather events, and rising sea levels. Across the globe, adverse events from climate changes are having devastating effects on water and food supplies, disruptions to supply chains, causing forced population and wildlife migrations, precipitating civil unrest, and increasing physical and mental health-related illnesses. But just as nurses are skilled at turning around the deteriorating health that humans sometimes experience, they're also good at addressing the critical condition of our planet.
There was quite a deliberation on the planning team of Nurses Drawdown because Project Drawdown has hundreds of solutions. But it was really important for us that we looked for solutions that had a co-benefit, that as nurses themselves mobilized patients and communities to participate, not only were we drawing down greenhouse gases and improving the health of the planet, we were improving health of humans.
Understanding the impacts of climate change on human health is critically important for the global population. In this episode, we meet Teddy Potter, a nurse who is directing her energy towards creating a livable and sustainable future. And we learn how nurses can and are reducing greenhouse emissions. We find out why educating girls is key to a healthier planet. And we discover who the best intergenerational storytellers are for helping us understand our relationship to and stewardship of the planet. Since the planet is such a vast topic, we launched this episode by asking Teddy an appropriately big question about her views on the intersection of climate change, planet health, and what actions are urgently needed.
My name is Teddy Potter. I use she, her pronouns. I am working and living upon the land of the Dakota people. And I'm a clinical professor at the School of Nursing at the University of Minnesota. I coordinate the Doctor of Nursing practice in health innovation and leadership, which is preparing our future nursing leaders wherever nurses are called to lead. And I'm also director of planetary health for the school. Just addressing climate change, to me, felt a little bit like putting Band-Aids on a hemorrhage. The damage was being done so quickly. And in order to solve this, we have to address root causes. And until we can diagnose the root cause, we're continuing to patch up the symptoms. So it was using my nursing and my nursing knowledge to say, okay, let's figure out what's causing this, because only then can you develop effective solutions. And I see my role as an ambassador for the intersectionality of planet and human health, that this is all connected and we need to act fast, but it's not impossible, because I believe that humans have immense capacity. I believe we know what we need to do. Now it's a matter of getting activated. We just completed an international webinar for Nurses Drawdown. Today was nature-based solutions. It was just very apropos that that's what we're doing on Florence Nightingale's birthday.
Teddy, it is really, really good to be with you on International Nurses Day and to think about the poignancy of that. When we think about why was May 12th selected as International Nurses Day? I mean, it's Florence Nightingale, right?
It was her birthday, and she was a thought leader and an extremely innovative person. So I think it's highly appropriate that we're talking about innovation on her birthday and carrying that legacy forward of how we transform systems, how we think about health, how we ensure equity. We're all big parts of what she championed.
Well, and particularly the area that you have focused on with the environment. You're not the first one to think about this, right?
That's right. There's a wonderful tale in a book about her that she sat up in a tree on her acreage on her estate, and she came down from the tree, and in that experience of sitting in the tree, she really had insights about where health needed to go and how she was called to be involved. So she had a deep connection to our natural environment, and I think many nurses today are realizing you can't have the health of humans if the environment is not healthy. And we've just seen that full force in the COVID pandemic, showing us the interconnection of all those things.
Yeah, I mean, it's been such a full force display of the connection of environment, community, health, equity, policy, practice. All of those roads lead to the same place.
Absolutely.
So you just finished up with a big conference. What was that conference? What was it about?
The conference that we just finished up was the Planetary Health Alliance annual meeting. It was scheduled for Sao Paulo, Brazil, but unfortunately because of COVID, it was a virtual conference. But we had over 5,000 attendees from 120 different nations. And it's people who are involved in recognizing that you cannot have health of humans without the health of the environment, and that the future burden of disease is going to be directly related to climate change impacts on biodiversity loss, vector changes, etc. So this was a gathering of people from all sectors to say, we have got to create great transition here.
All sectors. Name some of those sectors.
I could go on and on because there's nobody that can be left out. We need engineers, we need teachers, we need farmers, we need policy people, we need people of faith, we need people who manage and work with the forests. We have got to figure out how to do systems change. And no one discipline or profession has all the answers. We have a piece of the puzzle. And so we need to be coming together at the shared table to see how we can advance the health of the planet. And that's what it was about. It was a very exciting week.
You have such a smile in your voice when you talk about it. And I think oftentimes when we have these discussions around climate change, climate action, there's not always a smile there. There's definitely urgency. We need the urgency. But when I hear that smile, what is giving you that sense of uplift and happiness when you're talking about bringing people together from all sectors to really protect the planet and to have it be healthier?
I'm smiling because there's something we always can do. The planet is in extremely dire states. Multi-system failure is the best word to explain it. Nurses roll up our sleeves and say, okay, let's asset map. Who's available? What skills are in the room? Who can do what? And we start to orchestrate the solutions, the change. So I spent many years fighting against climate change. And now I'm fighting for a livable, sustainable, just future. So I've pivoted a little bit on how we use our energy. And it really does come down to nursing. I just say my patients just keep getting bigger. And now I'm caring for the planet.
Constellations, maybe, that might be your next
right, or galaxy. But it really is the same, whether I'm caring for an individual patient, a family, a community, a healthcare organization, or the planet. It's deeply listening to the needs of whoever we're caring for. Deeply looking at the science and applying the science of best practices, communicating the need for all of us to be involved in the work.
So let's talk about climate and human health, that relationship, how changes in the climate are impacting health, and specifically, what are the climate-sensitive health outcomes? So let's start with that very broad climate and human health. What's the relationship there?
And I'm going to go even more broad, and that's related to my work. I'm a director of planetary health. So if I were able to wave a magic wand and climate change disappeared tomorrow, it is only one of multi-system collapses that are happening right now. So our forests are being cleared. We're losing biodiversity. We're having an extinction rate that's 1,000 times normal of the species on this planet. The oceans are acidifying. Land is becoming desert. We have soil, air, water pollution. We have changes in rivers drying up, extreme weather events. So the climate is part of the problem. It's a symptom of the problem, and it's much bigger than that. And then you asked about the health impacts of all of this. I think sometimes people think, oh, we'll start seeing problems around 2100 or maybe 2050. We are seeing changes now. We're seeing increased impacts on cardiovascular diseases. People who are living with respiratory diseases are certainly feeling the impact. So people with asthma or COPD are feeling the impact of a changing climate. Infectious zoonotic diseases, well, nobody has to ask us if those are real anymore. With the COVID pandemic, it is here. Antimicrobial resistance, heat strokes, malnutrition, civil unrest and trauma and strife, and mental health impacts of seeing a place that we love, a land that we could bank on supporting crops, become disrupted to the point where our livelihoods are gone and a place that we love has been destroyed. So it is happening now. These impacts are happening now. And if anybody doesn't believe me, ask your young people in your family or in your neighborhood or at your university, what do you feel about climate change? And many will talk about their despair and their lack of hope for the future. I do want to mention the 2019 Lancet Countdown Executive Summary, which basically says the life of every child born today will be profoundly affected by climate change, with populations around the world increasingly facing extremes of weather, food, and water insecurity, changing patterns of infectious disease, and a less certain future. Without accelerated intervention, this new era will come to define the health of people at every stage of their lives. That should wake nurses up.
What I think is really interesting is that we talk about climate and health, and oftentimes it's not a clear picture. In talking more and more with students in our health professions, having them understand the relationship between climate and health and that civic engagement piece. If I'm remembering the story correctly, your role at the university was actually driven by student interest and student concern about climate change. So can you say a little bit more about, how did that happen, and how are students really important catalysts in us understanding the connection between planetary health and human health?
So we're at a point with young people, and I've certainly seen it these last maybe 2 to 3 years, where we're working with the internet generation. Young people have grown up with total access to information, science, fields of study, articles, and they're also learning about climate change and environmental degradation in their pre-college courses. And so they're coming with a certain level of knowledge. So I'm seeing two trends. One is nursing students who say to me, I had no idea that I could be a nurse and concerned about the environment. They're off doing environmental work, environmental activism as their volunteer work, but they had no idea that that was connected. And then we have other students who are, oh my gosh, it's so connected and I'm not getting what I need to practice responsibly. So we realized at the University of Minnesota, listening to our students, that they were the ones to drive change. I could talk to our deans and our provosts till I was blue in the face about why we need to include this in the health science curriculum. But it's the students, our constituents, that really can drive that point home. So we did a survey of the students and we asked them, how many of you feel that in order to be practicing responsibly, feel that you need additional information about climate change and the health impacts of climate change? Well, it was 95% of the students that were surveyed. We need this. And then we said, and how many of you are getting this in your current curriculum? And it was probably 5% of the students. So we were able to take that student feedback to the deans of all the health sciences and say, our constituents, the people that we're serving, the reason we're here at a university, are not getting what they need. Well, that lit a fire under the deans, which lit a fire under their unique schools. And then I had each of the deans appoint somebody who would work with me to co-create interprofessional climate change curriculum. So we have that at the university now. It's open access, it's peer reviewed, it was created by teams of experts, and it can be embedded in any curriculum across any health science. Without the younger people and their voice and their activism, we'd still be back trying to build a case that it was important.
How are you using this role to influence other curricula outside of your university? It seems like you are very busy in a lot of different work groups on this.
I am busy. A lot of it is through the Planetary Health Alliance at Harvard and sort of shepherds this alliance of groups and people working on planetary health. I'm chair of Clinicians for Planetary Health, which is health professionals, healers, anybody who's in the healthcare field all over the globe. We have a committee and a meeting space to move that forward. We just completed Planetary Health Education Framework that was just released at the annual meeting in April. And that will be the framework for creating planetary health curriculum in all nations, across all sectors, through all disciplines. What are the principles of planetary health that we feel is necessary for our students to learn? I'm also involved in Nurses Drawdown. Yeah. That's a partnership between Project Drawdown, which provides us with exceptional science-based solutions to drawing down greenhouse gases, and the Alliance of Nurses for Healthy Environments. We've paired these programs together to create a movement called Nurses Drawdown.
In the Nurses Drawdown, I love this very bold, audacious statement. You talk about that nurses being the most trusted health profession in the world, that they have this power to significantly impact climate health, climate action, and that together, nurses around the globe can significantly reduce greenhouse emissions. How on earth, pun intended, are nurses specifically able to impact greenhouse emissions?
One of my favorite quotes is an Ethiopian proverb, and it says, when spider webs unite, they can tie up a lion. And I really, really believe that individual strands can be very weak and perhaps not accomplish a great deal. But when they work together, anything is possible. We can tie up the lion of climate change by working together. So that's the premise behind Nurses Drawdown. And just the start of Nurses Drawdown, the idea was born when I went to the People's Climate March in New York City in 2014. 500,000 people were there, 500,000. Wow. And I carried a sign that said, Minnesota Nurses for a Healthy Future. What happened next blew me out of the water. As I marched along, people came off the sidewalks and said, the nurses are here, the nurses are here. They wanted to take selfies with me. They wanted to send it back home. They wanted to tweet that the nurses were here. Well, there was one nurse right at that point in time marching. But I thought, if we have that much of an ability to inspire people that were showing up on this issue, what's possible when you mobilize the global nursing workforce? Because people are watching us. They trust us. They trust our messaging. They trust that we have their best interests at heart, that when we ask them to eat a plant-based diet, do more walking and biking forms of transportation, to consider planting trees, they listen. So this is who we are. It's living into our profession. And like the spider webs that you might feel weak as one, we're a strong force to be reckoned with when we talk about the global nursing workforce.
The Nurses Drawdown is a very clear statement of purpose and mission and what we're going to do. And then there's a very specific action plan of, and here are the steps that you specifically as a nurse in your practice can help to reduce greenhouse emissions.
There was quite a deliberation on the planning team of Nurses Drawdown because Project Drawdown has hundreds of solutions. But it was really important for us that we looked for solutions that had a co-benefit, that as nurses themselves mobilized patients and communities to participate, not only were we drawing down greenhouse gases and improving the health of the planet, we were improving health of humans. So we chose 5 core areas, and they're areas that nurses have always talked about and always worked on. Food is one. Nurses have always been concerned about the adequacy, the access to food, the quality of food. So we are really promoting a plant-based diet in places that do not have a lot of options for cooking. We're promoting clean burning cook stoves, so that we're not doing deforestation. And we're encouraging in countries that there is more access to food to really be mindful about food waste and working on that. The next one is mobility. We know that being mobile helps improve health. So we're advocating for good bike infrastructure, safe walkable sidewalks, and that people use more mass transit when it's available. We're encouraging nurses to promote clean energy, not being wasteful of the use of electricity and energy, and to transition to clean energy sources. Our 4th one is educating girls. In fact, educating girls and family planning, if you put those together, it rolls almost to the top position of one of the most key strategies that we can use against greenhouse gases. Educating girls gives girls employment options and allows them to care for their families in ways that also are sustainable. And then our 5th area is nature-based solutions, which is planting trees, protecting tropical forests, and promoting afforestation rather than deforestation. So those are our 5 areas. Each of them has co-benefits. Each of them improves the health of humans as well as the planet.
When you say it, it makes perfect sense. But I would not have put educating girls as a key factor in reducing greenhouse emissions. So it's clear from the standpoint of the health benefits when societies educate their girls. We've seen healthier outcomes across many, many, many dimensions. But I would not have put that reduction in greenhouse emissions in there. So that's surprising.
I might just add that we're at an all hands on deck moment in that we have got to come up with solutions to address the severe disruption of natural systems, and we have to come up with them quickly. So if you were asked to do a task and somebody said, oh, but you can only use 50% of the skills and abilities and gifts of the people, I think that was crazy. That's essentially what's happening when we're not educating girls and supporting girls in their full development. We're missing 50% of the brilliance of human potential to solve our problems. So that's another reason we have got to be ensuring that girls have equal access to education.
You mentioned the Alliance of Nurses for Healthy Environments. Say more about that alliance and what they're doing.
The Alliance of Nurses for Healthy Environments is the primary professional organization for nurses who are involved in working with climate change, working to ensure health of environments for all our patients. So climate change, they also address areas around air pollution that impact people unfairly, the disparities around where are highways built and who is constantly exposed to fumes from freeways, et cetera. They present information to our policymakers to ensure that policymakers understand that nurses are watching the policies to ensure that they are protecting our people and not impacting health. The Alliance of Nurses for Healthy Environments also supports nursing research. It is a wonderful alliance of nurses all working on behalf of the health of our environment.
Yeah, healthy environments, as you were just referencing, goes beyond climate or is more expansive than climate. And increasingly, groups like this particular alliance, they come together because they see the populations and the communities that they're working with, populations that are being especially hit hard by degradation to the environment. I'm thinking about the populations that are low income, indigenous, people with disabilities, people with chronic conditions, pregnant people, newborns. We have groups and communities that get hit harder than others. Why is it that if it's the environment that we all live in, and we're all breathing the same air, we're all drinking the same water, why are some people more impacted and harmed by our environment in general?
Which is a great question. And at the root of that, we have to unpack the story that exists. Structural racism and colonialism, extraction industries, all would like us to think that some people are weaker or have put themselves in harm's way. That couldn't be further from the truth. All humans, our bodies work the same way, but there's these pressures that can impact the resilience of people. So I think that's what you're getting at. There's not something intrinsic about a BIPOC community of why they're being hit harder or choices they're making that make this more difficult for them. It's lack of access to, in many ways, be able to escape the harm that we're causing. So if you're a privileged person, if you have advantages, if you have opportunities, if a hurricane's coming your way, you drive out of the harm's way. Look at COVID. We set up parking lots where people could drive in and get their shot. Well, what about the people who don't have a car? Right away, our structures were limiting who had access and who didn't have access to testing. So it's often built into our structures that certain people, certain communities are not thought of, are not considered, are not allowed to thrive in their environments. Not to mention sort of not in my backyard, we would put the garbage burners, incinerators, toxic waste dumps, et cetera, in neighborhoods with lower socioeconomic status, where people didn't maybe have the ear of the legislators to make these decisions. It's about the structures that we have set up. And that, more than anything, is related to which communities are suffering and which communities are not.
So, as it's a structural issue, it's very hard for one person to improve the water supply or to make air quality safer. It takes a collective action. But when we think about those structural pieces, we're increasingly using data, we're using technology, we're using interesting partnerships. What are some of the things that you're seeing to address planetary health, innovations, solutions that are helping us to address these structural issues?
Well, data is neutral, so we have to always be asking, what's the source of the data? Who funded the studies? What questions did they ask? Did they invite community participation in asking the questions? Who's driven the data? What's the purpose of the data? Because you can collect data on just about anything. But we do have data right now. We have data that shows disease rates related to zip codes. We know that you're more likely to have a shorter lifespan if you're living in certain areas of risk. So we do know that. Now it's a matter of not just having the data, but saying, it's here, folks. What are we going to do about it?
I've seen some really interesting ways that we're combining data and technology to help us target our interventions. We can use that to target our policy, our warnings, our prediction. I think about right now with NOAA, the National Oceanic and Atmospheric Administration, getting better at predicting weather patterns,
yes,
are able to help us send out alerts to the right group of people at the right moment in time for them to prepare for a weather event. I'm thinking about unlikely partnerships. Like, how are we using data that really help us to improve or to mitigate so that we don't have so much of this climate impact on people? And I was thinking very specifically disaster response.
So you're talking about population health and how we use data to preserve population health. And I want us to be mindful that there's two approaches. Just like in healthcare, there's illness care, which deals with the issue after it's already occurred, and primary prevention, which tries as best as it can to stop this thing from ever happening. So we need to be working in both areas, certainly protecting people and saying, climate change is real, it's here. We will alert you to severe weather patterns. We will alert you to the status of hurricanes that are approaching the coastlands. But at the same time, we don't want to just be alerting people to the crisis. We want to be stopping the crisis. So we need nurses working in both areas. And to your point, it's exciting what's happening now with data being able to help us understand likely pathways. But we're also part of a big system, and systems are pretty fascinating in that there are unintended consequences, there's unexpected feedback loops. Some people will say, well, why can't you tell us when climate change is going to get at its impacts are going to be at their worst point? But it's very difficult to collect information about what's going to happen in the future. We can talk about likeliness and it's likely to happen, but it's not something that we can predict within a finite piece of this tornado is going to happen on this day. That's a weather prediction. That's not a climate prediction. But we can say as the climate gets worse, the oceans get warmer, the number of hurricanes increase. So we can make these connections, but to use it to warn people specifically, it's a little more challenging.
So when you think about innovation when it comes to climate action, what are some of the things that come to your mind? I mean, when you mentioned our young students who are technology natives and they understand how to use tools to be better storytellers, to gather people, to create movements, what are some of the technologies and innovations that you're seeing that are specifically addressing planetary health?
Innovation is extremely broad. So it is not just about new technologies or uses of data. It is about creating transformative change in everything we do, everything we do. If we anchor it too much to technology or too much to an invention or a product we're creating, what happens in people's minds is they say, I don't do that. I'm not innovative. I'm not creative. And then they're not available to help with this great transition. We have roughly about a decade to change everything, not just our policy, not just climate change. We have to change how food is produced, how we consume food, how we produce products, what products we manufacture, how we do energy, what are our cities going to look like, how do we construct those cities, what's our relationship with the natural world and landscape. We have to change our stories about our space in nature. And that's going to require massive innovation across all fields. We need people in food systems and agriculture. We need people in land management. We need the healthcare and biotechnology areas. We need manufacturing, chemistry, business, technology, urban planning. We also need all of these sectors to come together. So it is an incredible time of innovation. But again, it's not just about new products, it's processes, it's lifestyle choices, it's living in community with one another, it's policies, it's innovative in that it's creating a future, a human future that is viable for future generations.
The innovation landscape to impact the planet's health is so vast. When you were mentioning food systems,
yes.
How are we growing? How are we harvesting? How are we storing? How are we distributing? And then when we go to our energy production and our energy consumption, waste management, you talked about making sure that we were good stewards of what it is that we produce. So there's just such a broad landscape that there's a place for anybody and everybody to jump in. No one group can do this.
See, that's just it. Nobody should be excluded at this point.
Yeah.
It's got to be us working together. And innovation doesn't occur in field A or field B. It occurs when A and B come together and there's this liminal space where something becomes possible. 1 + 1 = 2. You have to have the plus. And that's where innovation occurs. That's the relationship between people, fields, nations. That's hugely ripe for creating this great transition.
One of the players that you mentioned that I don't think we bring up very often in innovation or in health, the faith-based leaders and our spiritual guides, how are they a part of the connection between climate, planet, and human health?
It's all about relationships with ourselves. How do we treat ourselves? How do we view ourselves? How do we view our potential? Our relationships with one another, every place from the family to a nation. It's about relationships with the future, relationships with the past. And no one tells the story or the narrative better than faith-based organizations, as well as spiritual guides and leaders. They have been talking about ethics, shared space, and justice for decades and decades and decades. And they can help intergenerational communities start to take action. There aren't a whole lot of spaces where the generations come together. So it allows us to come together, work together, have a shared mission to restore the health of the planet, restore the health of humans.
Climate and pandemics, they have a very strong relationship.
Yes.
And as we think about nurses' roles in addressing the COVID-19 pandemic, responding to saving lives, limiting the loss of life, and reducing illness, how is it that addressing the climate and nurses leading that are going to reduce the likelihood of or the severity of future pandemics?
Sure. And it's a great opportunity to extend my gratitude to nurses all over the world that are on the front lines of caring for individuals, families, communities impacted by COVID. Nurses have really been in the key place of providing care. So I want to do everything I possibly can to prevent future pandemics from occurring. And why are we seeing more and more and more of these events occurring? So we've got SARS-CoV-1, we've got MERS, we've got Ebola, we've got SARS-CoV-2, and we have other of these zoonotic diseases teeing up because of the way that we're living. So how are we living? We're decreasing places where wildlife are able to live. We're decreasing their habitat. So there's shifts and patterns where the wildlife go. Then they're being brought into closer and closer proximity to humans where you can see zoonotic diseases occur. We're seeing human migration into areas that were once the previous habitat of wildlife, and human consumptions and human choices that are decreasing biodiversity and causing these problems to arise. So we need to be working on these upstream issues if we want to prevent the suffering we're seeing right now. And we all have to go up there and do everything we can, because as bad as COVID has been, and it's terrible, and what is happening in certain countries right now with massive loss of life, it is still not the worst that we're yet to see. So we have got to intervene quickly on restoring the balance to our natural systems so that we do not have these problems continue to rise up.
Yeah, that's one of the points of conversation and comparisons that have been made is pandemic preparedness is very much the same type of attitude and preparedness that we need to take for climate. And if we think that this pandemic has been bad, we can't even imagine the type of disruption and loss of life and loss of livelihood and other pandemics that it creates within mental health and so many other impacts when we think about a disruption to the climate. The pandemic has done a very good job of showing when one thing happens and systems start to fall apart, they fall apart quickly and people suffer in so many different ways. So COVID-19 being a wonderful illustration of what happens when you're not prepared for catastrophes. How are you using that to help people become more urgent about action or improving the health of the planet and taking action to reverse climate change?
COVID has, as you said, given us a in-our-face example of you can't buy your way out of this. You can't relocate someplace and avoid COVID. It is everywhere. And no matter who you are, it is there. And so we have the attention of people that we might not have had in the past. We also are having the urgency of people saying, I thought we had more time. And so people are at a critical moment of their ears being open. I'm a little concerned that as we vaccinate, quote unquote, return to normal, people have not learned that normal is killing us. Normal is not normal. It's highly dysfunctional. And that's what got us in the problem to begin with. So as our habits broke, our travel habits, our purchasing habits, our consumption habits were disrupted by COVID, now is the time to say, and what did we learn from this? What are we going to keep in place that occurred during COVID that we want to keep those new habits in place and not return to a quote unquote normal that is contributing to the problem? Did you eat differently? And if you did, you cooked more at home and you were more intentional about perhaps family time or food selections or how often you went to the store. Perhaps you were more attentive to not wasting foods, letting it rot in the refrigerator, whatever. Maybe you were very mindful of not driving a lot. You only went shopping once a week and you bunched your chores together. Whatever those things were, now's the golden moment to say, look, you did it for a year and a half. Keep doing it. It will help us have a healthier planet and not tee ourselves up for more pandemics to occur. So that's what I'm trying to help people understand is we have the science, we have the knowledge, we know what we need to do. We know it's urgent. We have plenty of reports from the United Nations, World Health Organization, et cetera, letting us know the urgency. Now it's up to us to say, Yep, and I'm going to do it. And I'm going to do it with future generations in mind, in that the most underrepresented group that we have are future generations. They're not choosing to live in a world that's destroyed. The children are not choosing. So we have to consider the impact of all the habits that we have in place and which ones are no longer worth continuing.
The other area that I would love for you to speak to, that we don't spend a whole lot of time on, because I don't know that people really make the connection between our mental health and well-being and nature and planetary health. And mental health was already an issue before the pandemic, but across every demographic, every age, we are seeing so many people really struggling and suffering with despair, with depression, with hopelessness. And there's a very clear connection between mental health and well-being and the environment and nature. What do you want to say about that?
Oh, you're asking me about one of my favorite topics, because I believe that being in and around nature is one of the most powerful restorative measures that we can have. And science shows us that as well, that when humans have a chance to be in nature, even for a small amount of time, it does help our immunity. It decreases our stress, our blood pressure goes down, mental health and well-being improve. So we know this. And so we need to be making this connection of actually preserving nature is preserving ourselves. It's increasing our sense of well-being, our sense of meaning. But you're mentioning something that's very real. Psychologist Glenn Albrecht in Australia first coined the term solastalgia to indicate this profound sense of loss and grief when an area that we love, a geological area, a land area, water, is destroyed. There actually is a psychological condition called solastalgia, where your whole being aches because you're seeing these changes. We add on to that isolation, that a lot of people today are living in isolation. They don't have close relationships. Perhaps their only relationships are electronic. Being alone compounds that sense of loss and hopelessness. So what you're talking about is real.
I can't imagine a better way, actually, to be spending International Nurses Day, thinking about a global workforce that is focused on global health, thinking about the role and the impact that nurses have on individuals and an entire planet, an entire set of ecosystems. And I think Mother Nature would definitely join our group. I think we could induct her into the International Honor Society of Nurses. Nurse Teddy Potter is deeply committed to planetary health and climate change education, and she has a long list of activities and projects to prove it. Working in partnership with Project Drawdown and the Alliance of Nurses for Healthy Environments, Teddy led the creation of Nurses Drawdown, a project which invites and encourages nurses and midwives around the globe to take personal and professional action in 5 key areas to help the world reach a point where levels of greenhouse gases in the atmosphere stop climbing and start to steadily decline. She also chairs Clinicians for Planetary Health and is a member of the steering committee of the Planetary Health Alliance at Harvard University. At the University of Minnesota School of Nursing, she is a clinical professor, the director of planetary health, and she coordinates the Doctor of Nursing practice in health, innovation, and leadership, where she prepares nurses to lead wherever they are called or choose to lead. Teddy has a big title, big responsibility, and in listening, you can hear a big smile. I think that comes from working with students, our youth, and Mother Nature. With each day, season, and weather data set, the links between planetary health, human health, and the health of future generations become more clear and more urgent. Understanding the impacts of climate change on human health broadly is critically important. Teddy points to statements and summaries from the Lancet Medical Journal, warning us that many more people than previously thought will be exposed to extreme weather events over the next century, a potentially catastrophic risk to human health that could undo 50 years of global health gains, and that the health of a child born today should not be defined by a changing climate. Game-changing technologies and multinational accords frequently grab headlines and attention for climate action, whilst the simpler, potentially more effective ways to tackle the climate emergency get less attention, as is the case in educating girls. Project Drawdown, best known for providing information and insights about climate solutions, brought together a broad coalition of researchers, scientists, business leaders, and policymakers, and came up with the top 100 activities that would contribute most to this goal of drawing down greenhouse emissions. And at number 6 sat an initiative that is rarely talked about in environmental circles: educating girls. Research indicates that educating girls has multiple benefits that go far beyond the individual and any particular society. It can also result in rapid and transformative change that affects the planet itself, and do so better than, for example, an electric car. When it comes to innovating for planetary health, it's a smorgasbord of opportunity. Our environment needs innovation in all areas of how we think, we live, and we breathe. When looking for solutions to climate change, Teddy reminds us that many of the health practices in caring for individuals and communities are entirely translatable to caring for and healing our planet. As scientists, healers, and system thinkers, clinicians have an ideal framework to lead planetary health. And as Teddy shares, many of the changes that improve planet health also improve human health, and that many of these changes are rooted in behavior change, and nurses are masters in teaching and supporting healthy behavior changes. Everything is connected. What we do to the world comes back to affect us, and not always in the ways that we would expect. Understanding and acting upon these challenges calls for massive collaboration across disciplines and national boundaries to safeguard our health. And as Teddy so clearly demonstrates and marches and advocates, nurses play an integral role in all areas of innovating for planetary health. For See You Now, I'm Shauna Butler. Thanks for listening.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.